Well, there is, of course, great concern that Christmas gatherings paired with New Year's Eve celebrations will fuel more coronavirus cases, leading to even more hospitalizations. Our medical centers are already overwhelmed. NBC4 contributor and clinical nurse specialist Alice Benjamin joins us now. Thank you, Nurse Alice. You've helped provide context for us throughout the pandemic.
Well, thank you so much for being here, for having me. I mean, this is a very important topic, and I'm here to help the people.
Well, let's start with this concept of rationing care, because we keep hearing that our ICUs are just overwhelmed. So this is when hospitals are forced to make some very difficult decisions when it comes to you or your loved one. So take us inside the hospital and walk us through how those decisions are made.
Well, I want everyone to know that we've actually been rationing since the beginning of the pandemic. As more and more people were getting sick and our hospital systems were being overwhelmed, we had to ration things like equipment, PPE, ventilators, and all of those things. But now that we've somewhat been able to catch up, we're actually getting exhausted. So we're running out of critical care trained staff. The patient population has increased exponentially. And so now we're really reaching the point where, like, hey, guys, doesn't matter how much more equipment we have, we don't have the space. So now there are teams, decision-making teams, sometimes they're called ethics committees, that are now being pulled in to help make some very difficult decisions. So in the event we are at capacity, we have more patients than we do resources, how will we disseminate and determine who will get the treatment and who will not? So it's a tool that we have in the hospital. We're hoping we don't have to use it. But it's something that we definitely need to be talking about now, because with the current trends in infection rates and hospitalization rates, it looks like we're heading that way.
And speaking of the trends, I mean, we are seeing enormous lines above the Dodger Stadium testing site. Right now, for example, News Chopper 4 Bravo is overhead. And Nurse Alice, as you look at this image, you can see these lines are some of the longest we have seen in days. I know they've recently reconfigured how this site is handled, and that could perhaps be one of the reasons why we see the chain of cars, looping around one of the parking lots there, because they're trying to take some pressure off the neighborhood. But this really speaks to the concern that people have about having COVID.
Absolutely. I've seen people wait almost an entire day in line trying to get tested, and the testing sites were closed for the holidays. And we know that many people, against their better judgment, did gather with family. And so I'm sure that there's some concern or fear that they may have been exposed to COVID that way. And also with a new strain of COVID-19 out there, knocking on our back doors here in San Diego, concerns that may be floating around, and it's more infectious from what we know thus far. And so I think all of those concerns are prompting people to get out to the testing site to know, do they have COVID or do they not?
And you have been working just incredibly long hours. You were just telling me that you were recently called to a pediatric unit. Tell me a little bit more about that.
Absolutely. So in the hospitals, we have our designated areas, ER, ICU, med-surg, but all that is kind of out the window now. We are taking care of patients wherever we can. If you drive by some hospitals, you'll see that they have tents outdoors for their emergency rooms to take care of patients there. Some hospitals have actually resorted to using conference rooms and, empty parts of their cafeterias to take care of patients. So we are trying our best to take care of as many patients in any overflow area that there is. As an ICU and ER nurse, I'm able to provide critical care. So wherever the patient is, I'm able to provide that care. So no longer is it just designated to just the ICU.
And you were telling me, though, that when you were called to help in the pediatric unit was filled with adult patients.
Oh. Yes. So I was called to the pediatric unit. I've taken care of peds patients. So I thought, okay, well, that's fine. I can do that. But when I arrived to the unit, there were actually more adult patients in the pediatric unit than there were adults. And when I questioned what happened, they just said, you know what? We didn't have as many peds patients, and we had more adults that needed services and beds. So those adult patients were now in the pediatric areas. So some of the pediatric nurses, their skills are even being stretched a little bit. But actually deploying someone like myself, we actually kind of have this team model where I'm the skilled critical care ICU nurse helping not only take care of patients, but to help my colleagues who may not necessarily have that exact skill set and help them to take care of other patients who need help as well.
Yeah, what a team effort to keep all of us safe. Thank you so much, Nurse Alice, and we appreciate your time with us, too.
Thank you.
Health officials in San Jose are closely monitoring a coronavirus outbreak at a hospital ER.